Hello, everyone, and welcome to your recorded lecture for today. Today, we are talking about cellular regulation, specifically screening for cancer and care of cancer patients, sickle cell anemia, lead toxicity, and hyperbilirubinemia. That just rolls off the tongue, doesn't it? All right. So, when we talk about cancer, cancer is essentially a group of disease with different causes. It's not one single disease with a single cause. It it's a group of diseases with different causes, manifestations, treatments, and prognoses. Um, Cancer nursing, also known as oncology nursing, encompasses all age groups and nursing specialties and is carried out in a variety of healthcare settings, including the home, the community, nursing specialties, um, acute care institutions, rehab centers, and hospices. The scope, responsibilities, and goals of oncology nursing are as diverse and complex as those of any other nursing specialty. Oncology nurses have to be prepared to support their patients, their families, all through a wide variety of physical, emotional, social, cultural, and spiritual experiences. And they usually guide people from diagnosis through the end of their life or survivorship, which is the ultimate goal. Cancer is characterized by uncontrolled and unregulated growth of cells. It can occur in people of all ethnic groups and ages. The incidence is higher in men than women. It is the second leading cause of death after heart disease nationally. So that's in the US. And it is the leading cause of death in many of our states in the US. Most cancers occur in people of age 65 or older. That means I got maybe 5 years. Um, Cancer is the second leading cause, like I said, of death in heart disease, and both males and females. Um, but it is often the leading cause of death in people who are Hispanic, Asian American, or Alaskan Native. The greatest amount of deaths are usually cancers of the lung, prostate, and colorectum in males, and cancers of the lung, breast, and colorectum for females. So this is kind of a picture of what a cancer looks like. Um, how it goes from a normal cell down here at the bottom to overgrowth. As we know, if you remember from your A&P classes, cells are controlled by an intracellular mechanism that determines proliferation. And that basically means a rapid increase or multiplication in numbers. And in cancer, cells grow on top of one another and on top or in between normal cells. Cancer cells respond differently than normal cells to intracellular signals, and they divide indiscriminately. So, this is just a slide I like to put in here as an interesting fact. Henrietta Lacks was an African American woman whose cancer cells are the source of the HeLa cell line. And if you've never heard of the HeLa cell line, it's a pretty interesting story. Um, and I encourage everybody to look it up because this poor woman died of cancer and we are still using her cells today. Um, this was the first immortalized human cell line, and it's one of the most important cell lines in medical research. And it's estimated that her cell contributions have saved over 10 million lives. That's a lot of people. Um, Her cancer, she was a tobacco farmer, and her cancer was cervical cancer. And they took her cells without her knowledge. This became one of a very important tool in medicine. It was vital for developing the polio vaccine, cloning, gene mapping, and in vitro fertilization. Um, Her cells have been bought and sold by the billions, yet she remains virtually unknown, which is sad because she has contributed a huge amount to medical science. I did recently read an article that her family was finally given compensation for all of these donations and, contributions that she made to the medical profession. Um, but Henrietta herself and her direct descendants never received any compensation, which is kind of sad if you think about it. So, when we're diagnosing cancer, the testing is very, very extensive. And it's important to think about that patients going under exclusive extensive testing like this, they're afraid of the procedures and they're anxious about the positive outcomes and test results that they're going to get. Um, the presence and the extent of the tumor is determined. Then we identify possible spread, also known as metastasis, to additional body tissues. We evaluate the function of involved and uninvolved body parts and systems and organs. Um, and we obtain tissue and cells for analysis to assist in the evaluation. That's usually via biopsy. And that gives us an idea of the tumor type, the stage, the grade, and the molecular and genetic changes that are occurring. Treatment goals may include cancer prevention, complete eradication of the disease, also known as a cure, prolonged survival and prevention of any kind of progression. That's kind of keeping things under control, or relief of symptoms associated with the disease, and that's usually palliative care. Primary prevention of cancer. Um, we really want to encourage people to participate in regular physical activity. We want people eating a balanced diet, which includes limiting red and processed meats, limiting sugar, sweetened beverages, and highly processed foods. We want to encourage people to avoid excessive sun exposure. That's why we're always telling people wear sunscreens, wear hats, stay out of the sun. Some prophylactic surgeries are recommended. We want people to avoid smoking, and we always encourage the HPV vaccine. That can prevent certain types of cancer as people get older. When we're talking about secondary prevention of cancer, um, on the left side of your screen, you can see what the focus is, and on the right side of your screens, there's some warning signs. Focus is on early disease detection. That's really the key with cancer. The earlier we detect it, the better we can treat it. So we want to give public awareness about health promoting behaviors. We want to encourage people to have screenings for cancer, the PSA test for prostate cancer, colonoscopies to test for colorectal, and mammograms, of course, for breast cancer. Um, and then you can see the American Cancer Society seven warning signs. These include change in bowel or bladder habits, um, a sore that does not heal, unusual bleeding somewhere, um, indigestion is one of them, nagging cough or hoarseness. There's a whole list there and you can read about it. But this is really it's important to encourage people to get seen right away if they're noticing any of these signs. All right, now we're going to talk about sickle cell anemia and sickle cell disease. Sickle cell disease is a disease of hemoglobin. Hemoglobin, in case you don't remember, it carries O2 within the red blood cells. In sickle cell disease, the cells become stiff, and instead of being flexible, they're stiff, and they form a sickle or a crescent shape called hemoglobin S. This is an inherited disease. There are three types of sickle cell disease, and you can go to page 788 in Wong, and you can see detailed definitions for all of these. The most common one is sickle cell anemia. And it is the most common form found in African Americans. This is one of the most common genetic diseases worldwide. It affects approximately 100,000 Americans every every year. Um, and it also includes other nationalities. It's not just Americans. It happens to Africans, Hispanics, Italians, Greeks, Iranians, Turks, um, and people of Arab, Caribbean, Asian, or Asian Indian descent. It really can occur in any ethnic group. The gene that determines whether the sickle cell shaped hemoglobin S cells are present is always detectable. So if we are looking for this inherited gene, we are always going to see it. And it's important to remember too. I'm sorry. If both parents have the sickle cell trait, there is a 25% chance that their offspring will develop sickle cell anemia. So this is a picture of what normal red blood cells look like. I personally think they kind of look like frisbees. Um, and you can see the cross section of it with the normal hemoglobin, and then you can see what cells in sickle cell look like and how they could potentially block blood flow. What are the symptoms? Possible growth retardation. These children, in children, they may look smaller. And they may not be growing like a normal child would. Chronic anemia. This is usually a hemoglobin level of 6 to 9. Um, they might have possible delayed sexual maturation. So, like, if they're female, they're not gonna menstruate as early. And they might not be getting, pubic hair and things like that, earlier on in life. It's going to be delayed. And they're going to have increased susceptibility to sepsis. There is a really good table in your Wong pediatric book on page 790. It's box 24-2, and I put that in red because I want you to go in and read it. So please do. Thank you. Complications of sickle cell anemia. Vaso-occlusive crisis. So this is something that we see a lot in sickle cell disease patients. They often go into different types of crises. Um, the vaso-occlusive is known as a painful episode. That's what patients might refer to it as. It is severe pain lasting minutes to days or longer even. It can be precipitated by cold, infection, dehydration, exertion, or ischemia. And ischemia is essentially it's death. Sequestration crisis. This is when there is a large amount of pooling of the blood, usually in the spleen, and infrequently in the liver. This causes a decreased blood volume and may ultimately cause shock. The severity is variable. And this could result in somebody having to have their spleen out, also known as a splenectomy. A plastic crisis is when there is diminished red blood cell production. This is usually triggered by a viral infection that may result in profound anemia. Um, it's often or usually precipitated by infection with the parvovirus B19, also known as Fifth's disease. Transfusions are usually required with aplastic crisis. Hyperhemolytic crisis. This is when there is an accelerated rate of red blood cell destruction. And this is characterized by anemia, jaundice, and reticulosis. Then there's acute chest syndrome. Um, this is clinically similar to pneumonia. The symptoms include fever, cough, increased sodium production, tachypnea, dyspnea, or new onset of hypoxia. And then these kind of patients can have a stroke. This is a major complication. It is primarily vascular complication because the sickled cell will block the blood vessels in the brain, resulting in an infarction. Um, this causes various degrees of neurologic impairment. And if you think about sickle cell disease, it's very common in children. And, you don't picture a little child having a stroke, but it is possible. So this is a slide of the effects of sickle cell disease on the different body parts. When we're talking about therapeutic management, and collaborative care, newborn screening, that's highly important. We screen newborns for sickle cell disease. We provide genetic counseling if necessary. Acute and chronic management of patients. This is important. When these crises begin, well, the goal is to prevent them or to quickly manage them with either antibiotics, oxygen, hydration, or pain medications. Um, Medical management of a crisis is usually supportive, related to whatever symptoms the patient's having. So the main objectives are to minimize energy expenditure. Like we don't want people getting tired too much because we want to improve their oxygenation. If you think about it, sickle cell disease is it affects the way your blood is carrying your O2. These patients are going to be tired, and we don't want them exerting all their energy. Um, and always think ABCs, airway, breathing, circulation, right? Um, we want to make sure these people are staying hydrated. Um, they're probably going to need some kind of electrolyte replacement. And analgesias as needed. Like, we want to provide adequate pain control, blood replacement if needed. That's where your transfusions come in, and antibiotic therapy if any of this is related to an infection. We also want to be aware of stroke prevention, and think about the fact that bone marrow transplants may offer an ultimate cure. So, when we're talking about sickle cell disease, chronic illness adherence can be more of a problem for some patients. And this is because the treatment plans are more complex. They may involve intrusive procedures such as injections or IVs. Patients might have new diets to follow. They might have multiple daily meds, and they're probably going to have changes in lifestyle. Other factors that can include adherence to treatment include the age of the child. If it's a child, their age makes a big difference. How long has it been since they've been diagnosed? Income level of the family can be a big factor. Some of these treatments can be expensive. Educational level of the parents is important. We want to make sure that they have a good education regarding this and understanding of why they're doing what they're doing. And family dynamics are important too. When I say family dynamics, I'm talking about like blended families and single parents. We want to make sure that these parents have support systems in place and they're not trying to do it alone. When patients have poor adherence and they're not adhering to treatment plans, this results in poor outcomes and decreased quality of life. Kids will miss school. They'll have changes in academic or their social functioning. It causes missed work for parents, which can be a hardship. Increased hospital visits and admissions, and a financial burden on families and society. So, when we're talking about diagnosing sickle cell disease and sickle cell anemia, again, we go back to newborn testing, and screening. We are checking CBCs to see how many red blood cells are present and how much hemoglobin is in them. And this also evaluates the size and the shape of the red blood cells that are present. They will do blood smears, which is when they take a thin layer of blood and they view it under a microscope, and this will show the presence of the HGBS. Um, Iron studies. I'm sorry, that should have an S at the end of it. This measures iron storage and supplies in the body, and it helps determine if it's iron deficiency anemia or iron overload versus sickle cell. Blood typing and cross mass matching is done usually, and this is in the event that transfusions are required. Organs that are affected by sickle cell disease, the spleen is a big one. Um, Splenic injury begins early and is often without symptoms, and it can result in life-threatening infections. The lungs are affected as a result of acute chest syndrome. And again, I'm referring you back to slide 11 because that talks a little more about that. And then the brain is affected related to effects of strokes on the brain or the central nervous system. All right, so now we are going to talk about lead poisoning. Lead poisoning is a serious and sometimes fatal condition that occurs when lead builds up in the blood. Lead is a very highly toxic metal, and a very strong poison. It can occur at any age, but it's more likely to be found in children under 6. And it's important to know that children absorb 2/3, they absorb it into their body of any of the lead that they ingest, while adults only absorb about 10%. And this is often because children are engaged in hand-to-mouth activities. You know, when kids are little, they put everything in their mouths. Um, and it's important to also know that people who consume diets that are low in calcium and iron and high in fat are at increased risk. So there is an increased incidence in economically challenged children. Um, and that goes back to being related to the fact that that these children are often living in houses where there's still lead paint used, or it wasn't properly removed, or it wasn't properly covered. It can be related to a lot of different things. And this is why children in general are more vulnerable than adults are. Sources of lead, lead-based paints, soil and water that were contaminated with lead, any lead containing products, and believe it or not, sometimes women's makeup contains lead. Certain occupations and hobbies are more at risk for absorbing lead. Ethnic and cultural practices, and when I'm talking about that, in some cultures, the use of traditional remedies or home remedies that contain lead may increase the risk of lead poisoning. Pica practices. If you don't know what pica is, I'm not going to get into it too much, but I will explain that it is often people that eat things that aren't food, like paper or paint chips or anything like that. And certain fish, such as tuna, shark, and swordfish, has high contents of lead in it. Systems affected by increased lead. The hematologic system, it interferes with the production of heme molecules, which are what binds the iron, and this leads to anemia. The renal system, this is because damages to the proximal tubules of the kidney can occur, and this can lead to proteinuria, ketonuria, and decreased vitamin D. And then the neurological system is affected. And this will lead to tissue atrophy. Lead disrupts the biochemical processes and may have a direct effect on the release of neurotransmitters and cause alterations in the brain. It can also interfere with regulation of your synapses in your brain. This is the most serious system affected. So this is a slide of how you can see how it directly affects the different systems, and what some signs and symptoms are, especially in the neurologic system of low dose exposure versus high dose exposure. These are some symptoms of lead poisoning. Patients will often appear, and this doesn't happen to everybody. Keep in mind, this is generalized symptoms. Abdominal pain and cramps, aggressive behavior, constipation. They may have sleep problems, headaches or irritability, loss of developmental skills. So these are children that have already accomplished some of these developmental milestones that all of a sudden have a loss. Um, Loss of appetite, fatigue, high blood pressure. They may experience numbness and tingling in their extremities. They may present with memory loss, anemia, or kidney dysfunction. Long-term effects of lead poisoning. This includes behavioral problems, low IQs, poor grades at school, problems with hearing, short and long-term learning problems, and growth delays. These are signs of toxic dose and lead poisoning. So this is when you know somebody's had a toxic dose. Severe abdominal pain and cramping, vomiting, muscle weakness, stumbling when walking, seizures and coma, and then encephalopathy, which manifests as confusion, coma, and seizures. Treatment includes chelation therapy, and these are the different types of medications. EDTA, this is given IM twice daily for 3 to 5 days, or it can be given IV over several hours. Um, it's important to remember that this can be toxic to the kidneys, and we have to carefully calculate the dose and monitor kidney function during treatment. DMSA, this is an oral medication that is given over 19 days. And then BAL, this is usually given in an IM form, and it's in conjunction with one of the other therapies. And then we're always doing routine screening. MDPH Childhood Lead Poisoning Prevention Program. This program has certain recommendations, like don't sand, scrape, or burn lead paint while you're pregnant. When you're pregnant, use cosmetics, folk medicines, and art supplies with caution. Um, eat eat foods that are high in calcium, vitamin C, and iron. Um, and don't use tap water for cooking, drinking, or making baby formula. These can all help prevent. This can all help prevent lead poisoning. Um, Routine screening. We always want to make sure we're doing routine screening. Oh, I already said that. So there's two different types of prevention. We have primary prevention. And this is some federal laws that were put in place that homeowners of homes older than that were built in 1978. So if they're older than 1978, they have to cover or remove lead paint. It's a federal regulations. And then there's CPC and EPA guidelines. Secondary prevention includes, this includes making sure that people have safe blood levels, and it should be less than five micrograms per deciliter. And usually something important to know is that chelation therapy is usually given um, when the blood level is 45 micrograms per deciliter or more. All right, so now we're going to take a couple minutes and talk about hyperbilirubinemia. And then we're almost done. There is a quiz that you will have to take at the end of this, so it will be opened after your exam. So when we talk about hyperbilirubinemia, that's not an easy thing to say, first of all. This is a condition where there's too much bilirubin in the blood. Um, Red blood cells break down and bilirubin is formed, which it accumulates in the blood. and it also accumulates in the tissues and fluids of the body. So, after circulating in the blood, bilirubin travels to the liver and then it is excreted into the bile duct and stored in the gallbladder. Hyperbilirubinemia cannot be totally prevented at all. Early recognition and treatment are important in preventing levels from rising to dangerous levels. Symptoms include jaundice. So that's when you will see a yellowish tint to the sclera of the eyes or the skin, particularly in the face, is where we usually see it first. Um, in infants, it might be, poor feeding or lethargy. They might present with either of those. Causes. So the reason why hyperbilirubinemia occurs is during pregnancy, the placenta excretes the bilirubin. When the baby's born, the baby's liver is supposed to take over. But if the baby's liver can't excrete the buildup of the bilirubin, then this occurs along with jaundice. And it's quite common actually. About 60% of term babies um, develop jaundice, and about 80% of premature babies develop jaundice. Infants of mothers with diabetes or RH disease are more likely to develop hyperbilirubinemia and jaundice. Um, Different types of jaundice may occur. Physiologic jaundice occurs. This is a normal response to a baby's limited ability to excrete the bilirubin in the first days of their life. Breast milk jaundice may occur, and this is caused by a substance in the breast milk that increases the absorption of the bilirubin through the intestinal tract. Breastfeeding jaundice, this is caused by a failure to initiate breastfeeding. This can result in dehydration and decreased urine production and accumulation of bilirubin. Late preterm infants who are born are more susceptible, and that's usually between 34 and 36 weeks. And this is because they don't have the coordination and the strength to maintain successful breastfeeding. But it can be common in full-term babies as well. And it usually gets better once breastfeeding is established. Jaundice from hemolysis may occur. This can occur with the breakdown of red blood cells, which is normal. Red blood cells break down. But this could be related to hemolytic disease of the newborn, which could be RH disease, or from having too many RBCs that break down and release the bilirubin. And jaundice can also be related to inadequate liver function. And this could be due to infection or other congenital factors. Diagnoses. Timing and appearance of jaundice helps with diagnoses. Jaundice that appears in the first 24 hours is serious and requires immediate treatment. Jaundice that appears on the second or third day is usually physiologic. And if it happens more toward the end of the first week, it could be related to an infection. And then when it happens even later on, that's usually related to the breast milk. In order to correctly diagnose it, direct and indirect bilirubin levels are tested. And when I say direct, we are looking at the bilirubin that's stored in the liver, so that it can be excreted. And when I say indirect, we're talking about the bilirubin that's circulating throughout the blood. We're looking at red blood cell counts, and we're doing blood typing and testing for RH compatibility. And this is called a Coombs test. Treatment. When we treat hyperbilirubinemia, we are considering the following. We're looking at the baby's gestational age, their overall health, and their medical history. The extent of the disease, the baby's tolerance for medications, procedures, or therapies, and expectations for the course of the disease. Like how bad is it and what do we expect to happen? Phototherapy is a very common treatment. That's because bilirubin absorbs light. Jaundice and bilirubin levels decrease when exposed to special blue light spectrum lights. But it's important that we need to protect that baby's eyes to prevent retinal damage. Um, we can use fiber optic blankets. That's a form of phototherapy. Transfusions are sometimes used. And we want to make sure we are providing adequate hydration. Um, Either breastfeeding or pump breast milk should be continued. And we want to treat any infections if necessary. Um, it's important to know that low levels of bilirubin are not usually a concern, but large amounts can circulate to the tissues in the brain, and this can cause seizures and brain damage. We don't want any of that to happen. And these are the references. And like I said, there will be a quiz after your exam. When you're done looking at this, you should be able to go on and take the quiz. Um, it's only a 10-question quiz. You shouldn't find it too difficult. And I hope you have a fantastic rest of your day. Bye.